Hello and welcome back to the PSC in Conversation, The Next 20, the series where we're exploring what the opportunities and challenges are for public services over the next 20 months and the next 20 years. I'm Aoife, and today I'm joined by Senior Partner Antonio Weiss and co-founder of the PSC, Russell Cake, to pause and reflect on what we've learned in the series so far and what public service leaders can take away from this, both now and in the coming years. Russell, Antonio, welcome back into the studio.
Aoife, it is such a pleasure for this to be hosted by you. I'm absolutely thrilled. I'm Antonio Weiss, a long-standing part of the PSC and really specialise in digital and AI transformation within public services.
And I'm Russell Cake. I'm co-founder and senior partner at the PSC. I've been here since 2006. I specialise particularly in health and care and in strategy and finance projects.
Great, thank you both. So over the past 8 episodes, we've heard from leaders across health, care, government, education and beyond. And while the contexts have been quite different, I found that many of the same themes have been cropping up. So I wanted to start by today with one of those themes, which is that while public services are kind of facing 21st century pressures, they're often doing this with 20th century system designs. So Russell, I think this was something that came up quite clearly in your first intro episode. I think it was you actually said yesterday's design of public services isn't necessarily the best design for today. And David Seymour as well pointed to long-term drivers such as digital and data, kind of a rising public expectation, greater, diversity. And then this was also echoed, I thought, in Makoto's podcast when she was talking about mental health systems and how they still kind of use placement rather than, relational proximity or support closer to home. So I'm going to open with a question to both of you, which is, across these podcasts and in your work, where do you see the greatest mismatch today between, 21st century pressures and 20th century systems?
I'd start with almost any service where there's a material mismatch between demand and the ability of the service to keep up. So thinking that applies in criminal justice, it applies in community healthcare, it applies in social care, it applies in acute healthcare. And we see a number of services where the volume of demand has gone up, the complexity of demand has gone up. That's true in criminal justice when we're looking at the nature of some of the criminal cases. So that happens now, the amount of data that's available on those cases. So demand has gone up, but systems have not been able to grow their productivity at the rate that demand has grown. And that's led, in many cases, to backlogs or an inability for the systems to keep up. And that leads to, waiting lists and ultimately to a less good service for service users. Antonio?
I completely agree with that demand change. And part of that is a demographic one as well. The Welfare State Foundation was, the demography of the UK was very, very different 75 odd years ago. To today. But the other bit that I feel is the other side of the equation is the expectations gap has also shifted. And that was accelerated enormously with the internet and smartphone revolution, where people would expect on-demand, near instantaneous services. And we have this new wave of AI on top of that, which gives you this instantaneous, personalized, wrapped around you attachment, weird chatbot style interface with so much of the private sector. And, we were talking Aoife this morning, looking on the tube, certainly coming into London, everyone is on their phones. And that dissonance between people's expectations of a service, which is wrapped around them through an interface of a phone lens, and actually a public service experience, which is really, really quite different in many instances and feels an ever widening gap. That to me seems really quite material now, and really came through in the podcast episodes we've heard.
I think there's also a visibility of what's possible and the dissonance between being aware of what's possible from services and what often is available. That also becomes very stark to people.
Can I throw a question back on this kind of gap in terms of rising expectation and what's available? What do you think it would take to close that gap?
Several things in parallel. So I wonder if it's because I think there is no one silver bullet. So we've talked quite a lot across these podcasts about technology, but it's definitely not technology on its own. We've talked a lot about service design. Mm-hmm. I think there's also something about, as you change the technology and the design of services, the roles of those who are delivering the services have to change, and then their skills and their behaviours have to change. There's probably more than that, but you put those things together and it's a fundamental transformation in how services are delivered that's required then to bridge that gap to expectations. Antonio, you might tell me I'm missing.
No. I agree. The bit, and we will come on, I'm sure, to talking about public value design imminently, and that's really the emphasis on working out, what really is adding to the meeting the true needs of a citizen and ensuring that any service is truly focused on that. But an element which strikes me that comes through the series so far is, new institutions don't come about very often. So our work in the space industry was helping the UK Space Agency set up digital services from scratch and actually create new ways of working, new governance mechanisms, new service provision. And that should be the expectation to meet new needs and new challenges of the 21st century. We should be unafraid of saying, well, new 21st century institutions and ways of working need to come in. It might be okay to retire the old. And that's something that is not quite being felt yet, but I suspect is coming, and there's a big part to play in addressing that gap.
Great, thank you both. And we're going to come straight on to public value, which is something that has been discussed kind of throughout the different episodes, which is how do we design services that people actually want to use? I think, Russell, that was something that you pointed to in the first episode of rather than being pushed towards private services. And that was, I guess, echoed that it's not just about efficiency. We're not just looking at, improving productivity, but we're designing services that are, for the service user. And again, in the Schools Buying podcast, Reza and Katie pointed to they didn't, achieve £1 billion, pounds in savings through cuts, through harsh cuts. It was through designing a tools that people who were in the schools actually wanted to use. And again, in the British Red Cross, they talk about how their high intensity user services are for, users who frequently attend to A&E, and that as a result of focusing on the user has had, a real system impact. So actually that has, by designing services around the user, it's had benefits for hospitals who are seeing, fewer attendances. So my question, and I'm going to send this to you, Russell, is what does public design actually mean for public service leaders in terms of when they're looking at reform?
So I think public value design is about, so I think it's useful to start with the public value first, and thinking about that is, as you said, more than productivity, more than efficiency. It's about meeting the user's needs. I think it's also then beyond the user, it's also about societal needs. So we think if we look at, for instance, healthcare, there is something about helping people to get better, but there is also a societal benefit about helping people back to work. And so it is about the user and meeting their needs, but it is also about the broader impact on society. And then when we come to the design bit, it's about designing services so that they can do all of those things. They can be productive, they can meet the user's needs, they are workable for the staff who are delivering the service, and it actually makes the working life a pleasure for those staff. And then they are about meeting broader societal needs.
Absolutely. Great. Thank you.
And if I could deep dive to re-plug, they're all brilliant podcast episodes. But the Schools Buying one, it has a special place in my heart because the project was just so special. And please do check it out. Not just, I think, I hope it wasn't too introspective. But as a nutshell for the public value design, what it meant in practice was previously. So the exam question was, how do you save money on the non-staffing bill of the school sector, 22,000 schools across England at the time. And the way that traditionally the non-staff pay bill spend had been, people would try and address that was they would go through very classic procurement routes. We need some normal frameworks. We need some more procurement contracts. We need to develop new guidance. We need to do draft legal templates and focused on the procurement side of the aspect. And the schools buying strategy instead said, no, let's use a user-centered lens and work out who's actually doing the buying. And the key point there was in schools, they are not procurement professionals in the vast majority of those 22,000 schools. They are school business managers who might might be, well, now there is a professional group thanks to that work, but they might also be teaching assistants who also administrators who are also clerks of the school who also have the buying challenge. So it was about working out truly like, who are these people? What are their day-to-day challenges? What do they really need from a simpler buying system? And one of the big points was they need to buy off someone they trust. So going to like a big national catalogue, which says we'll give you something better value, is not a particularly compelling proposition. You would much rather pick up the phone to somebody in your neighbouring regional educational authority at the time and say, hey, Sally, what do you think of this outfit? And we were trying to design a system which met the reality of those needs. And it was something that was brilliant that the Department of Education was so welcoming and doing. And I think it's a great example of public value design in practice.
Brilliant. Thanks so much for sharing, Antonio. So I'm going to move us on to the next point, which I don't think we could have this kind of reflection podcast without talking about technology. And Russell, that's something you mentioned earlier about, using technology as a way of meeting that gap between rising expectations and the services that exist. But what we've heard throughout the series is exactly that: is technology is necessary, but it's not the only solution. It needs to be accompanied by human-led change and that. And I think the clearest examples to me in that was in digitizing social care. We heard from Michelle, who talked about how, technology is a great enabler to let humans do what they do really well, which is the caring. And, we cannot use technology to replace that element of human care. And Daniel Kelly as well on the Debt Advice podcast was saying that automation without empathy risks alienating people who need the most support. So there absolutely is a place for technology. He was talking about how technology can be used to help with case notes, and actually that helps again people do what the people do best. So my question to you, Antonio, on this one, given your work in digital and AI, is what do you think are the conditions that are required for technology to really add good public value rather than just being kind of more noise in the system?
And those podcasts from Daniel and Michelle are brilliant because they, as you say, they help to shine a light on what is particularly human about the service element, and in Debt Advice, that empathetic side and understanding of the human condition is pivotal. In terms of the answer to your question, what's needed, one concept that we are encouraging clients more and more to think of is this idea. So in technology terms, many model developers in the AI world will talk about the concept of smallness. So actually, rather than use the biggest foundation model possible to check whether your email is grammatically correct, actually, why don't you use the smallest model necessary to deliver the required outcome? And I think there's something helpful in the concept of, for want of a better term, if somebody has a better one, please send us a note, but like enoughness. What is enough technology to actually solve the true public value requirement that needs enhancing? And it may well be that it is a new CRM or case note system, or it could be something a lot simpler than that. It could just be an API that connects you to a different system, which is actually creating a lot of friction at the moment. It could be some changes to a data processing agreement. It may not be that you need a big bang, multi-hardware device-led change. But focus first from the point, like, what is the minimum viable requirement? What is the enoughness that we need to solve the problem? I think that's where you should be starting from when you're thinking about, can technology help us? And is quite different to the tech vendor-led approach, which is much more, here's a solution, let's retrofit it to your problem.
Great. So I'm going to move us on now to a different theme that's also been coming up, which is about behaviour change and productivity. So this was, I suppose, something that we talk about a lot at the PSC, is how to create, lasting transformation, change that continues even after, consultants have gone and that kind of thing, and building capability within an organisation. And I think that came across really clearly in Ellie's podcast on people and productivity, and she was challenging this narrative on Britain's productivity crisis and saying actually the solution to that isn't necessarily technology, but it's also about building investing in humans and building the capability within those organizations, and through that method we'll improve productivity and hopefully then meet the rising kind of expectations and closing that gap as you were talking about, Russell, in terms of demand. And I think that also came out again in the Schools Buying podcast, which, Reza described as a hearts and mind problem rather than actually, it wasn't a procurement problem. It was about designing something that people would actually use. So Russell, I wanted to ask you whether you think, in your work at the PSC and within public services, do you think there is a misdiagnosis that exists kind of when we're looking at public service reform, that people treat change as either a technical or a structural problem, and actually could be a behavioural problem? And therefore, what should leaders take away when we're looking at implementing behavioural and cultural change?
So I think there's definitely a behavioural component, but I wouldn't start either from it being purely a behavioural problem or from a technical problem. I think Ellie talked about actually where you get difficult behaviours in organisations, those may often be the symptom of something else that's not working rather than the root cause of the problem. So a symptom of an organisation where it's difficult to work. So I think in terms of your question, overall, we're looking at there's often a need for, as we said before, technological change. There's a need for new roles, new designs of systems, and that then needs people to behave differently to operate those. But it's definitely possible to have systems that are better designed so that it's easier to have behaviours that are constructive, or to have your systems designed in a way that leaves the workforce effectively fighting against the systems, and therefore you can see lots of counterproductive behaviours as a symptom there. So I think there is something about that holistic design in the round.
Absolutely. And I think that links to your point, Antonio, about rather than having a solution and retrofitting to the problem, it's actually taking the problem as a whole and seeing it as several aspects of a problem, and therefore designing a solution or, designing something that, affecting change that addresses every part of that problem, and having behavioural change, or, if you're going to be implementing a new CRM, for example, understanding that will then take training for staff to implement. And
Exactly so.
Yeah, great, thank you.
And maybe one of the bits which we will surely be on a new podcast episode, which will come on in due course, but the approach that we take, particularly in our transformation work and around capability building, it has at its heart the point that you cannot do just a one-shot. You can't do like a big training exercise and then expect everything will be fine. You can't just do a big training exercise and then an implementation ceremony. You have to do dedicated support, whether it's do one, see one, lead one type training, ongoing mentoring or coaching support. It needs to have a programmatic and systematic approach to make that change happen, and that requires consideration. It will always take longer than anyone would ideally like, but it'll take a lot less time if you do it well in that approach than if you kind of hit and hope, which we see far too often.
Thank you. And I want to build on that actually, because I think that came through in Jonathan's podcast on innovation, where he talked about innovation kind of being it's not actually just about the ideas, but it's that bit between where the ideas happen and, affecting change and making that work in practice. And that depends on systems, it depends on people, it depends on the whole thing. And I think that was also reflected in Daniel's podcast on debt advice, where he said, it wasn't about these big breakthroughs, but it was about redesigning user journeys, understanding those parts of it. So Antonio, taking that into account, what do public service leaders need to understand about innovation over the next 20 months? Is it about, the ideas, or is it actually about making change happen in real life?
So I loved that conversation with Jonathan, which was a long journey down to the south coast for me, but it was excellent. It was worthwhile because we got to cover so much in terms of the breadth of what innovation means. And I think the important but maybe noddy point, I'll try and make a better one to follow up, but that we really emphasize, you have to work out like what is the goal here. Is it in a clinical academic setting with a research and development focus, then you almost certainly do want some, you probably should be trying to optimize for true clinical innovative breakthroughs which haven't been done before, and that you require a different environment, a different risk tolerance, and a different setup, and importantly, like a different funding and governance mechanism to, by contradistinction, like the innovation which is just spreading good practices and embedding them well. And one of the bits that I think we touched upon, and we would encourage public service leaders to recognize, is that it is sadly actually quite innovative and incredibly important to do the basics really well. Actually, not many places still too many organisations struggle with flow on an operational basis, be that in wards, on the end-to-end process from particularly in hospital discharge. And actually, you can find true innovation in embedding those processes well in a manner that sticks and delivers the right outcomes for patients. And that is nothing to kind of turn your nose up at. It is its own form of powerful innovation.
I really like that. I think the word innovation has quite an energy to it, in terms of a word. And actually, when we're thinking about innovation, isn't necessarily having these big ideas, but it is just affecting change really well on the ground. There's something really energetic and powerful about that. Great. Thank you both. So I think we've got time for one more question today. We've already covered quite a lot of ground in quite a short space of time. So I'm going to ask you two slightly different questions to end. So Russell, I'll start with you, which is listening across the series and also in your work, and of course, having founded the PSC 20 years ago, what is one thing that you want public service leaders to take away from this series, or one thing that they should do in the next 20 months for the next 20 years?
And that's a challenging thing to break it down to one, because there are so many changes that are possible. I would think about that there is something about choosing which changes you're going to make in what order and prioritising, because there is so much change that is possible and there is so much demand for change. But as a leader of a public service organisation, there are only a limited number that you can do at any one time. So there is something about thinking what changes are most important in what order, and what changes can deliver the most benefit relative to the bandwidth that we have as a leadership team, because that leadership team bandwidth in every public service organisation is really quite limited. So there is something about selection, and that will be different in different organisations as to what combination of technological change, process change, role change, workforce change. But I think it is about choosing a small number and being realistic about which sorts of changes can be done in what order.
Absolutely. I really like that. And actually that was something that was echoed in the Sussex Out of Area Placement podcast by Harris, which was he found that the action was what got the momentum going. So it's I think sometimes we can be overwhelmed by, we want to affect changes across, for example, 10 programs. And actually it's just starting by one. And by starting with one, you get the momentum and people build the confidence to then be able to, it's almost like a catalyst for the rest. So thank you.
Exactly.
So Antonio, I'm going to slightly rephrase the question to you, which is, what are 1 to 2 things that you think public service leaders should do over the next 20 months to ensure that we're actually facing the 21st century pressures with 21st century system designs?
So, well, I might start with an arresting point, which I think the next 20 months may be the most important 20 months for public services since, I guess, the post-war settlement. Public services are in a challenged and a perception of deep challenge that great public service leaders are facing up to and will need to. So I hope that's both energizing, but also it's a recognition that it's hard out there. And 3 particular elements that I would suggest focusing on is, one is to relentlessly focus on understanding and delivering on public value. We still see too often that there are over-engineered, over-complex services being delivered which aren't focused on what the true value is. If you're somebody who requires, a good financial well-being, then your outcome is improving your financial well-being, and the service needs to be focused on that outcome, and anything else is tangential. The same is true, if in healthcare you want your health to be as optimally healthy and well for as long as possible. Appointment bookings are a function of that, but not the end goal. So focus relentlessly on understanding and delivering on public value. The second point is, I think it is now fair to say we live in a different era. The internet era came upon us and people are still adjusting to it. The AI era is here now, and it is here to stay. And that doesn't mean that AI needs to be the solution to everything, but a starting point should be, what is the role of AI in helping to deliver this public service better? And it's not ready yet, but it should still be a starting question as to how that could be utilized. And then the third element would be to say, don't be afraid to stop doing things. If they don't deliver value, now is the time to be looking hard and saying, actually, this is no longer required. This is a 20th century legacy approach that is no longer needed or fit for purpose. And doing that will free up time, headspace, cost, resources to focus on what really matters.
Brilliant. Thanks so much. And hopefully we should have a podcast for you very shortly on, really adopting AI in public services. So that's all we've got time for today. Thank you very much both for joining me on the podcast to reflect.
Thank you, Aoife.
Thank you, Aoife.
This has been the PSC in Conversation, the Next 20 series. We'll be back next week with another episode in the Next 20. Thank you very much.